Hello and welcome to the Chiropractic Educators Research Forum Conference, Keeping It Real, Practice Relevant Education. Our aim during this conference is to take an in-depth look at issues surrounding practice-relevant skills, knowledge, and attitudes throughout education programs. As educators, it is our responsibility to prepare our graduates for practice. We must keep in mind the end product and what we are producing, healthcare providers. Our graduates must be able to demonstrate competency in relevant knowledge, skills, and attitudes to practicing healthcare in a professional, person-centered, and evidence-based manner. We recognize that we face constraints as we consider the content of our curricula. Our regional legislation or regulations may dictate the scope of practice. The length of our curricula determines how much we can include in our programs. As well, we face other factors such as costs and faculty availability. Thus, we must be especially thoughtful as we prepare and integrate essential practice-relevant skills, knowledge, and attitudes throughout our courses and programs. As educators, we must work together to keep education real, and we need to work with the end in mind. As we approach our teaching in the clinic and classroom, and as we consider our curricula, we must envision what we want our graduates to look like when they are in practice. Although we may not agree on every detail, if we keep our focus on what is best for our students and ultimately their patients, we will be sure to keep our education real and practice relevant. To discuss practice relevant education, we have invited a special guest to join us today. Our keynote speaker for this session is Dr. Deborah Bushway, who serves as the president and CEO of Northwestern Health Sciences University. She has served as a consultant to the Lumina Foundation regarding competency-based education in higher education, and as senior advisor in the Office of the Undersecretary at the Department of Education in Washington, D.C. She was educated in a scholar-practitioner model and practiced as a psychologist for over 20 years. In addition to her work as a healer, she has more than 30 years of experience in higher education and has authored numerous articles, book chapters, and conference presentations throughout her career. She also believes that higher education ought to be accessible to all and that it ought to serve as one path to enrich and empower people's lives. She has long been interested in innovations in higher education designed to improve student success. In fact, she pioneered the development and implementation of a successful competency-based direct assessment program. Along with her colleagues, Charla Long and Lori Dodge, she co-authored the book, A Leader's Guide to Competency-Based Education, From Inception to Implementation.
So I am absolutely thrilled that Dr. Deb Bushway is here today to dive into this topic, help us get our heads around this. She offers this really, the bigger view that for those of us chiropractic educators working in the trenches, she can capture this for us and kind of give us some thoughts. So I'm really looking forward to asking her some questions. But before I do that, I must say, can you see this book? This book.
There it is.
This is an awesome book. If you do not have this or your school does not have this book, I highly recommend you taking a look at it. If you're interested at all about competency-based education, this is, even though it's an easy read, thin read, but it's packed with information. And I would recommend you possibly doing maybe a book club, getting all your faculty administrators together, read it, and then discuss it, because this is filled with good information. And Deb is the author of this book, and it's absolutely fabulous. So I would recommend that. I have some questions for you, if you don't mind reflecting back to us some of your thoughts on this. So the first question, sometimes we in chiropractic education are so close to what we're doing, it's difficult to see what needs to be done or where we need to go. You have extensive expertise in higher education and an incredibly valuable viewpoint from other disciplines. So from your point of view, what might we, chiropractic education, be missing as it relates to practice relevant education? There's your question number one.
Thank you. And I do want to say to people, if you do have any questions when you read the book, we are more than happy, my co-authors and I, to come and talk with folks. So, because we really do believe that this disruption is what's needed for higher education in significant ways. And I can talk about this way more than anyone wants to hear. But how, if we go back to chiropractic, I really do think it is a matter of taking a look, and people said this already today, and I'll say it again. It's really looking at the end state. So what is the goal here? What are we educating people to do, to be, and what's their purpose, right? Their purpose is not just to graduate from our institutions. Their purpose is to serve communities and to build healthier communities and to integrate with whoever is needed in order to build those healthier communities, right? We have to remain, I think, big picture vision. And so I think in order to get to that a little bit, we have to say, where are we now? Just really honestly with ourselves, where are we now? What are we doing right now? And then what do we think is needed to move into the future? Key thing here is if we're educating folks, some of you have said you're 30 years out from graduation. Maybe some of you are longer, maybe some of you I think are newer. If we're educating folks to practice into the future, we have to educate them how to be in the future, do things that we can't imagine, face things that we can't begin to think about. Earlier, I think it was Charnay as the individual's name who brought up AI. Honestly, that's one of the examples we have to educate our folks to sort of not fight the future, but to leverage whatever comes at us in the future for the benefit of our patients, our customers, our clients, whatever we call those folks that we work with. I personally don't call them patients, but I know you all do. So the beauty of it is, if we can educate folks, not only in the skills needed today, but in a way of critical thinking and some soft skills that carry them into the future. I think that one of the risks, honestly, so speaking frankly, which some of you know I will do, for chiropractic is that it digs its heels in rather than leans into the future, right? So we ought to be educating people to embrace and leverage what comes our direction. And I'll talk a little bit more about that. So what I would argue is we have to move out of what is still, we're not alone. We're not alone, so I'm not picking on us, but we are still rooted in hours as a proxy for learning. So the assumption that if I sit around you for a certain number of hours, I will learn from you, right? That's why we have grades, that's why we work on it well. Anyway, hours is an industrial age model where I punch a time clock, I sit around for a certain amount of time, I get a certain amount of pay. It's not production-based, it's input-based, not outcomes-based, right? So we've started to move, maybe, to an information age, right? Where people said, look, the industrial age has passed, we're in the information age, people need to be able to curate content. I'm going to argue that we have to be prepared for, and I'm sorry for you, Bart, you don't want to hear this, but we have to be prepared for, I don't know what to call it, the intelligence age. We have to embrace alternative or artificial intelligence and educate folks for that. And we had to been educating people to understand how to embrace things that we couldn't see, like artificial or alternate, people are calling it alternative intelligence. We had to educate them last decade so that they were prepared to think about that when it arrived on their doorstep. Things that we can't see because we can't really predict the future. So I think that's way more than you asked me. But sorry, too much coffee maybe this morning.
Another question for you. You've kind of touched on this. It's our chiropractic history in the profession. I'm proud to be a chiropractor, but sometimes the history gets in the way for some of us. And some of this infighting really gets to be frustrating, I think, for everybody, and no matter which side you're on. How do we get out of these battle trenches and work together? What do you see as important for educators to go beyond our philosophies, beyond these battle lines, so we can unify to focusing in on practice relevant education? The practice relevant education is the key. So any thoughts on that?
Yeah, I think it's such a great question. And I feel like a little bit of an outsider, so I'm going to try to tread lightly since I'm not a chiropractor, but I've been around for so long that most of you are willing to tolerate some of my thoughts. So thank you for that. But I love Dr. Abramson's sort of tongue-in-cheek diagnoses of curricula, right? So I'm just in love with those that work, and the things like I think he has the ossification one, that the curriculum gets stagnant because it's what we know, what we're comfortable with, we're not trying to make a stagnant curriculum, right? It's because what we feel confident about. So part of it becomes, how do we look into the future for ourselves as well? How do we bring ourselves into what we imagine that future to be? I mean, there were then we do some of what did he call it? I loved it. Iatrogenic curriculum. So that kind of tweaking, meddling around in the curriculum, which only makes it more fragmented and more complex, and makes students spend a bunch of time managing the curricular structure versus the content that we want them to walk away with, right? So we're asking them to waste their intellectual capacity really in doing that. So, I mean, I think if we educate ourselves, our communities, conferences like this, where people, I love your platinum room, I think you called it, that we have respectful debate, we have respectful conversation, that it's a skill to learn how to disagree with one another while respecting the position. I think that's really the path forward. That's a tough assignment. I think, higher ed teaches folks to be or rewards people for certainty. And certainly in an applied doctoral program, I think, one of the things we suggest to people is that they have confidence in their position. And that's a really good tool for patients and treatment settings, because that is one of the sort of soft skills, if you will, that shows a lot of strong outcomes, correlations with patients, and strong outcomes is confidence in the diagnosis, confidence in the treatment plan. Patients do better when that's there. But we can let some of that down with one another and maybe be a little more frank about our doubts, and maybe, think together. Every profession has different philosophies, if you will. I call them theories, right? It's about, maybe there's a place for most of them in the patient outcome and the student outcome. And we can find that maybe through a model that's, some have leverage with integrative care. Maybe we need to be referring to one another in some of those places as well. So I think it's all about trying to step up to a model that says, here's the outcomes we need for both our students and our patients, and there may be multiple paths to that. There may be some paths that don't lead to that. That's the hard discussion, right? So hopefully that makes some sense.
I guess my last question for you, we have just a few minutes left here. CERF, Chiropractic Educators Research Forum, is a community of chiropractic educators from other professions too. So health professions, anyone who's a health professions educator is welcome to CERF, of course. But we're typically individuals. We're working in the classroom, working in the clinic as individual educators or academic leaders. What recommendations do you have for us as individuals to improve practice relevant education? Is there anything that we could be doing, like Monday morning or next week, personal recommendations that you might have from your viewpoint?
Yeah, thank you. So I love the panel before, and I'm sure I'm going to love the panel here as well. I think they bring really strong, practical, important recommendations. So coming to events like this, being at this, I think is one key thing. I do think we could all ask ourselves on a regular basis, are my students or graduates being prepared for the critical analysis and understanding that they will need in order to respond to new developments in the world, be it demographic shifts, be it technological shifts, be it economic shifts? Are they able Are we educating them, not just skill-based training them, that's important too, but are we also educating them to respond to change? And that I think you can do both at an individual course level as well as a broad curricular redesign level, right? That's something that can be sort of modularized. It should be woven, of course, through content, but it can be done on an individual basis as well as on a more grand basis. So I think that's possible. Also, just be bold, take a risk, evaluate. I taught for decades, right? I did a lot of things that didn't work. And then I adjusted them, right? I didn't keep doing those ideally, but try, evaluate, do a continuous improvement mindset with yourself. Of course, I'm going to do a shameless sort of pitch for competency-based education because I'd be disappointed myself. Maybe you wouldn't be disappointed, but I'd be disappointed myself. I didn't. But competency-based education is one solution. It's a big change. It's a sea change, but it can also be done at the local level. Because if you really are talking about competencies, it mandates demonstration of every single competency. There's no averaging. You don't get a D on something and an A on something and pass. You need to perform every single competency. And so that is the outcome that you're looking for. And it allows personalization. So it's not everybody's going to spend 100 hours doing this. Maybe this person needs 20 hours to do that, but 200 hours to do this other thing. So it allows personalization. It shifts away from inputs to outcomes, and it allows something people talked about earlier. It's agnostic as to the source of learning, meaning that I don't care where you learned it. If you can demonstrate this competency with, the theory, the practice, and the attitude, as you guys have described, then you can move forward. So I think if you start asking yourselves, am I asking people to truly demonstrate competency? Am I also educating them for the future? I think it starts to get to a local level. You can do it in your course, and you can do it with others. I will admit that when you are the only one doing it in a course, in a broader curriculum, the students might feel annoyed with you. But that's okay.
Deb, thank you so much for letting me ask these questions. You've given us a very wonderful insight into how you think and maybe ways that we can approach what we do on a daily basis, how we can communicate different ways of looking at things with competency-based education. And I'm looking forward to future conversations with you, of course. And you're going to be joining the panel here at the end. So hang tight. Everybody who's listening and attending today, if you could put your comments in the chat to thank Dr. Bushway for her wonderful presentation just now. Let her know. Give her some claps for that wonderful. Thank you.